Hi everybody, it's Dr. Newman. So I had a patient ask me about what she was calling a liquid nose job. What people are talking about when they use that phrase liquid nose job is using fillers to change the appearance of the nose. Fillers are not the be-all end-all for the nose, but there are situations where using a little bit of filler can help change the appearance of the nose. And most commonly in my practice, when I have a patient come in with a bump on their nose, and frequently when they have a bump on their nose, they have a little bit of an indentation here. By filling up the indentation, which you would think makes the nose even bigger, but by filling up the indentation, the bump isn't quite as visible. And in many situations, I'll use filler here. Typically, I'll use a filler called Restylane Lift, and I'll use a filler here, and that will help balance out the beginning of that bump, making it look like there's no bump there at all. And these are mostly patients who don't want surgery, who are just looking for that slight change, and filler will do that very nicely. Filler can be used in the tip of the nose as well, but in a very delicate way. I'm not a believer that filler is the be-all end-all for the nose and can just solve every problem and change everything. I have seen patients where filler has been used, and then the filler, because of people wearing glasses or whatever forces they then have on their nose when they're sleeping, has actually shifted some of that filler and given them a little bit of a weird look. So filler done properly in the right spots can really help the appearance of the nose in specific situations.